Hello everyone and welcome back to the Donkey Advocacy Series. My name is Nice Jonathan and I'll be your host. Now on our previous episode we managed to discuss about the general donkey welfare and the rising threat of the illegal bush slaughter. And today we're going to indulge into another important topic, that is the donkey health. And joining me today is Dr. Sylvester from Farming Systems Kenya. He's going to help enable us to understand more about the donkey health. Welcome, Daktari. Will you introduce yourself and the position that you have in donkey?
Thank you very much. My name is Dr. Sylvester. I'm a veterinarian, but also I work as an advocacy officer at Farming Systems Kenya. Mm-hmm. Yes.
For how long have you been working there?
This is my 4th month in Farming Systems Kenya. Mm-hmm. Just new over there. Mm-hmm. Yes.
Now on to today's topic, we're going to begin with the general things. Maybe what are the common health problems related to the donkeys?
Thank you for that question. The donkeys have a whole system. Now, each of the health problems are associated with a specific body system. But in my years of practice, a few health problems that are associated with donkeys. One is colic. Colic is one of the major threats that has been affecting donkeys and even taking the lives of donkeys within our communities. But since we deal with working donkeys, other problems are associated with donkey health. We have injuries due to their nature of work and lameness, but also we have both internal and external parasites. So those are a few problems I can mention that are associated with donkey health.
You mentioned such a big word, the colic.
Yes.
You can explain more.
Now, colic, it is an interfering with the digestive system of the donkeys. So this is a condition whereby there is pain within the abdominal systems of the donkeys. So donkeys with colic are in pain. They tend to roll around. They tend to be dull and not eating. And colic is an emergency condition that needs to be addressed within the shortest time possible. And if not, it will take away the lives of the donkey.
So what are the main signs of the colic?
So if you see your donkey rolling is a major, it is a common sign in donkeys. Yes, they tend to roll. But if you see your donkey rolling, but at times when it stands, it tends to kick towards its belly, indicating that there is a problem within its abdominal cavity. So donkeys that have colic, they tend to kick towards their abdomen. They also flank watch, that is turning their neck towards the abdominal cavity where the pain is originating from. Yes.
So you say that those are the main signs and the vet should be called immediately?
Immediately, yes.
Now, thank you very much for that interesting answer. Maybe to our next question. Why do you think that there are these many health issues with our donkeys in the community?
Thank you for that question. You realize that donkeys are kept mostly in pastoral and agro-pastoral communities. And in these communities, they are handled by women or young boys. So you realize that when these women are handling donkeys, at times they do not take into consideration the signs or symptoms that their donkeys are sick. So by the time they are realizing that their donkeys are sick, we have already gone too far. By the time that they are calling the vet, the donkey is recumbent. That is, it is lying on its ground. It can't work any longer. So the delay in calling a veterinarian to respond to the health issues, that is what causes the health challenges in our donkeys. But additionally, you realize that donkeys work in, especially those in Limuru, they work in damp conditions. And in those conditions, those are wet conditions, they tend to develop hoof problems. And also, bacteria tend to multiply within those conditions. So when the hoofs are wet, we tend to develop either overgrown hoofs or laminitis. Yes, that's laminitis of the sole. Yes.
So how does that affect the donkeys usually?
Now, if, for example, a donkey's hoof is affected, in literally we say that the donkey is the hoof, because we keep donkeys majorly in Kenya as working animals. So if the hoof of the donkey is affected, then that donkey will not walk, it will not walk properly. The weight bearing capacity of that donkey is reduced. This means that the donkey will no longer work or is able to carry the load that it's supposed to carry.
So that means definitely that is going to affect the workload management of the donkey.
Yes.
Okay.
And also productivity in that case, because that person who is depending on the donkey to carry either goods or produce to the market, it means that they can no longer utilize that donkey to carry the produce to the market.
Okay.
Yes.
So maybe now concerning that, how can the donkey owners identify the early signs of the donkey illness?
Yes, early disease detection is very, very key in disease management. So we, as Farming Systems Kenya, we work with communities, and we usually enlighten our communities to let them know how to easily detect diseases on the earliest opportunity possible, that the donkeys do not deteriorate in health. And additionally, we work with what we call animal health service providers within our communities. So in each and every community where we work, we connect these women or donkey owning communities to animal health service providers, so that when there is a problem, they are able to reach them at the earliest opportunity. So we notify our farmers, if you see your donkey is not eating, that is one sign of disease. 2, when you see your donkey limping, it is a sign of lameness or disease. Donkeys are active animals. If you see your donkey dull, then definitely it is indicative of an underlying disease. But there are other visual signs. The eyes of the donkeys are supposed to be watery and clear, but not lacrimating.
Watery.
Not watery as in the tears coming down, but the eyes should be lubricated. So if you see your donkey lacrimating, that is tears rolling down from the eyes of your donkey, then that is an indicative of disease. Additionally, we also have skin conditions. The fur or the hair coat of the donkey is supposed to be smooth, but you realize that at times you get that donkey skin is rough, and if you find a donkey with a rough hair coat, it is a sign of an underlying disease. And majorly this is due to internal parasites are the one that bring about the rough hair coat. Also, the farmers should monitor the feces of the donkeys. They should not be too watery, that is in diarrhea. They should not be too hard. Yes, it should be a farmer consistency. So having looked at all those factors, they are able to indicate that whether your donkey is healthy or it is sick. Easy veterinary services are easily accessible. On affordability, it is between now the farmer and the animal health service provider to decide, depending on the treatment regime or the management regime on their animals. Then they can choose on a plan that favors both of them. Yes.
And you talked about government and private veterinary services. What is the difference?
Now, government veterinary services are those government vets, those that are employed by either the national government or the county government. So for us, the Farming System Kenya, we work like in 6 counties. So in each of these counties, we have both veterinarians from the national government and the county government. So those what we call the government vets. But we have those who are working in their private entities. They are not employed by the government. They are doing their own hustle within the territories where we work. So those are whom we call the private vets. And even us, those of us who work with Farming Systems Kenya, we still lie into the category of private veterinarians. Yes.
Maybe how does the donkey health affect the health of the owner, or rather the donkey community?
Yes, donkeys are majorly working animals. You rarely find a place where donkeys are kept as pets. So in the communities where our donkeys are kept, they are majorly kept as working animals. So if a donkey gets sick, that means that the livelihood or the means of trade that person was depending upon to undertake their activities, that is to carry the maize and either sand or whatever to the market, it means that activity will be paralyzed. So it will result to the financial loss of the donkey owner. But additionally, these farmers have a mutual attachment with these donkeys. And if their donkey is sick, it means that even their mental wellness is affected. Because that which they depended upon for their income can no longer provide income to them because it has been crippled. Yes.
So generally it affects the production of the farmer.
Yes.
And the donkey too.
And the donkey itself.
Okay.
Yes.
And maybe to the next question, what would you talk about deworming and the regular checkups of the donkey?
A regular health checkup for donkeys is very important. One is because it will help us to detect any misnomer or any disease at the earliest opportunity, and it is handled at the earliest opportunity possible. And therefore, the farmers or the donkey owning communities require to have a rapport between the animal health service providers and between them and the animal health service providers, so that in this routine checkup they are able to detect any illness at the earliest opportunity whatsoever. So this routine checkup, like you can do a deworming after every 3 months. Additionally, we do, as Farming Systems Kenya, we do hoof care. As I said earlier on, that the donkey is the hoof. So if you find that during your routine health checkup that the donkey has an overgrown hoof, you'll advise the farmer that you need to do a hoof trimming. And if you find that the donkeys have a poor skin coat or a rough haircut, you will go ahead and do a general deworming and even add some multivitamins. Yes.
So maybe you talked generally about the donkey health. What do you tell the farmers about the donkey health? Maybe?
What I will tell the farmers or the donkey owning communities is that donkey health is vital. A healthy donkey is a productive donkey. So the health of the donkey needs to be put at the inafaa kupatiwa kipaumbele. So what I tell the farmers right now is to just keep in touch with their local animal health service provider to ensure that their donkeys are vital, they are healthy, and they are able to continue working within their community so that they can give them maximum or optimal returns.
That's good. Now,
yes.
Maybe for the Farming Systems Kenya, are there any programs that you offer about the donkey health to the community?
Yes. At Farming Systems Kenya, we have four veterinarians. We have a vet in Bomet and Narok, we have a vet in Nyandarua, we have a vet in Nakuru. Those are 3 vets. But also myself, I'm a vet working with Farming Systems Kenya, but on the advocacy docket against the illegal donkey hide trade. So these veterinarians in the communities where they work, we do, together with the community engagement people, we do what we call donkey clinics. So in these donkey clinics, that we mobilize the farmers and let them bring their donkeys for routine checkups, and we do any wounds are managed, anything that requires surgical intervention, we do it. But generally, I would say that through these regular donkey clinics, which are paid for issues of sustainability, so we do these regular donkey clinics so that we are able to check on the health issues of the donkeys together with the local animal health service providers. So in this, also in these clinics, we do what we call animal health mentoring of the animal health service providers to ensure that they have adequate expertise to handle the donkeys when they get sick. Even when we are not around, when the farmers call them, they are able to get the donkeys for the farmers treated. Yes.